So again, good morning everyone. Let us first thank God for watching over us as we slept last night. Thank you, Lord, for your protection today. Thank you for your word. Thank you for your promise. To fear not, for you are with us. Be not be dismayed, for you are our God. You will strengthen us. Yes, you will help us. You will uphold us with your righteous right hand. Thank you, Lord, for your presence in our hearts and minds today. This is our prayer. In Jesus' name, amen. So how is everybody? We have how many meetings left? Or how many days more to go before the finals and one semester is off? Then proceed to the next semester in January 2022. So for perspectives in pharmacy, we have 2 more meetings left, and that would be on December 7 and on December 10. Okay, Mark Stevens, how are you this morning, Mark? Mark, nana ka diha? Mark Steven, let me see, unsay family name nimo, Mark? Bantay good mo ha.
Ma'am, Ladiero nga Mark, ma'am.
Mark, pila day mo
Ay,
ka, Mark?
Doc.
Yes, pila day mo ka, Mark. Mark, magod ako makita diri sa monitor. Sige, any Mark, nga naa diha. How are you? Mark
Ma'am, Doc
Ladiero.
doing good.
Ladiero, Mark. Okay. Mark Steven Ladiero.
Good morning, Doc.
Yes, good morning. Ikaw gyud na akong gitan-aw. How are you, Mark?
Doing good po.
Very good. You were absent last September. Ay, dili. Wala day kay absent. Sorry.
It's okay po.
Okay. So how are you, Mark?
Doing good po.
Doing good. And then when you woke up this morning, what did you do? Excited na ka sa finals because one semester off na.
Kuan, Doc, pag matanaw, kapoy pagyapon ng lawas kay
Why?
bag-oro mi kauli gid kagayan, Doc, actually.
Where have you been, Day?
Kuan, Doc, dito mi kagayan last Tuesday.
Until?
May gabi ira gid mi kauli.
Asa man day inyo?
Sa Ipil pa, Doc, sa Zamboanga, Sibugay.
Okay. So how many hours travel from sa Cagayan de Oro?
Ano, Doc? 8 to 12.
Wow, okay. Si Rexel, kumusta Rexel?
Good morning, Doc.
Yes, good morning.
I feel great po.
Very good. Nice to hear that. No? Okay. So, I think everybody is excited sa ato ang class today, sa atong lesson today. And there are times that na ma-out of topic outside. This is because I want to know whether or not you are still there. And I read that in your what you call this, in your feedback nga there are times nga ma-out of topic, sayang ang oras, but for me it's very important because it's my one way of getting closer to you bisan virtual. Okay, and I also take this opportunity to listen from you, to hear from you more about you, and for those who are not included, paminaw lang sad mo because you will also learn from what we have discussed bisan na out of topic. Okay ra? Okay ra, Reynaldo?
Yes, Doc.
Okay. Kono, sahay may man po nang makiusyuso ta ba bisan walay labot sa topic, but we can learn from that topic anyway. It is also for our advantage. Okay? You know, my favorite time of the day is in the morning. I feel alive. I feel great in the morning, and then mana nga mas alive sad ko with your block. No? when I discuss sa inyong black, alive kay ko. Yes, thank you for that, Ray. Murag musamot ko ka alive with that comment. Okay, so let's continue with our lesson. We ended up last time, pero mag-start ta sa where we would want to discuss. Nag-start ta last time on, or we have discussed last time on the importance of dosage form. And what is dosage form? Its components. Okay. And what are the major components of dosage forms? The therapeutic ingredients or the active ingredients or the medicinal ingredients that exhibit therapeutic effect. Then it also contains pharmaceutic ingredients or excipients that are non-medicinal. Then we discuss tablets, capsules, syrups, and then suspension. Diba? So let's continue with the next dosage form this morning on ointments. Okay, I will finish my discussion this morning before I give the announcements. This is to make sure that everybody is in. Okay, ointments. You are familiar with ointments, right? They are semi-solid dosage forms intended for topical application.
Doc,
Yes?
excuse me, Doc. I think, Doc, you're not presenting your screen pa po, Doc.
Yes,
Sorry.
Doc.
Sorry. Sigulang.
It's okay, Doc.
Sorry, good kayo. Thank you for that. Again, naka-remember na sad ko sa akong presentation during our academic council. Nahuman akong presentation, wala di ay nako ma-share akong slide. Sorry. Thank you. Mayroon lang diri kay you're polite enough to inform me nga wala di mas share screen. Ito yun sa academic council meetings with the deans, and I failed to present to share my screen. Oh, my gulay. Okay. Thank you for that. Okay, let's continue. Okay na ta? Larga na ta?
Yes, Doc, it's
Yes,
already
Doc.
visible.
Yes,
po.
Doc.
Thank you po.
Okay. So, klaro na. Thank you also for informing me. Okay, ointments are semi-solid dosage forms. Semi-solid. So, humok ni siya, no? Intended for topical application, meaning on the skin. They may be applied to the skin, placed on the surface of the eye. So, topical po siya kung eyes. Or used nasally, vaginally, or rectally. Okay. So, topical, placed on the eye, placed po sa nasal, placed po sa vaginal or sa rectal. Meaning to say, these different routes of administration, pwede ang ointment ani. So, always have in your mind that every dosage form contains the therapeutic or the active or the pharmaceutic ingredients. Therapeutic ingredients and pharmaceutic ingredients. The pharmaceutic ingredients, those are the non-medicinal substances that will facilitate in the formulation and administration of drug. Another is what do you think is this? Suppositories, yes. Suppositories are solid dosage forms intended for insertion into the body orifices where they melt, soften, or dissolve and exert local systemic effect. Suppositories, they are solid, intended for insertion in the body orifices where they melt, soften, or dissolve, and exert local or systemic effect. What does that mean? Always bear in mind that the active ingredient is incorporated with non-medicinal ingredient, and this active must be released from the dosage form. So how can this suppositories, how can the active ingredients released from the dosage form suppositories? One way is melting. The base or the vehicle melts. Once they melt, the active ingredient release from the dosage form. In other words, since this is suppository inserted into the vagina or into the rectum or into the urethra, they must melt at body temperature. So in other words, kaning suppository outside or wala pa gi-administer, they come in solid. Once they are inserted, ma-melt na siya at body temperature. So they are solid at room temperature. Room temperature is 25 degrees Celsius. So when inserted into the body which has 36, pila by normal, 37 no, 36 to 37 degrees Celsius, mo melt na siya. Once the base or the vehicle melts, then that's the time the active constituent is released from the dosage form. Another way is ma-dissolve, melt or soften, pareho ra na siya no. Another way of releasing the active constituent from the dosage form is dissolving. In other words, the base or the vehicle dissolves dissolved by the body fluid. So when the suppository is inserted, dili na siya ma-dissolve. Dili na siya mo-melt. Mo depende na siya sa vehicle or what we call it as ointment base, where the active constituent is incorporated. No, the pharmaceutic ingredients used in the formulation of a suppository that carries the ingredients is known as suppository base. So mo depende na sa suppository base whether it melts or it should be dissolved. So when the suppository base used in the formulation of suppository mo melt na siya, na ay kind of suppository base gamiton. Pero if imuhang ipa-dissolve, then another kind of suppository base ang gamiton so that the base will be dissolved by the body kanang secretion sa body, no, kanang body fluids. And this suppository may exert local or systemic effect. Local meaning the effect is just on the area where it is administered. Let's say for instance, kung gipasok ra siya sa lubot, diha ra siya mo effect sa lubot. Tag-constipate. Kung ipasok sa lubot, then na mechanism of action mahitabo, it may be irritation of the walls. Once ma-irritate na siya, mukos na siya nga maka-poop. Systemic, meaning the drug constituent or the active ingredients goes into the system, carried by the body fluids or to the blood, goes into the system. So meaning the effect is not on the site where the drug is administered. Okay, so local, the effect is on the site where the drug is administered. Systemic effect meaning dili siya sa site but it goes to the system, carried by the body fluids or the blood or whatever nga mo carry siya dito sa site where it is used. So it meaning to say it is remote or far from the site where the drug is administered. That is systemic effect. Okay. Let's continue. I think this is the last common dosage forms that I'm going to discuss with you. So to review, we have solid dosage forms. We have tablets, capsules, and what else? Suppositories. Solid ni siya. Then we have liquid, syrup, suspensions, and then semi-solid ointments. Yes? Yes, Ray.
Kaning sa kuan Doc, sa suppository Doc, katabi
Mm.
taw iyang murag coat niya nga mag-melt pag ma-administer na. Kanang, unsa to siya Doc? Kanang gel or what? Something?
Okay. Ang consistency sa gel is not solid. So, ang gel is another dosage form. Ang suppository is solid, meaning to say, the suppository is solid at room temperature, pananglitan. There is a suppository base nga cocoa butter, cocoa ba, theobroma oil, which is solid at room temperature. So kana siya nga suppository base, we call it as theobroma cacao or cocoa butter char. Once the active ingredient is formulated using cocoa butter as a base, will melt when inserted into the body because cocoa butter melts at body temperature pero solid siya at room temperature. So, another factor to be considered, ang sa storage, kung mo-melt siya at room temperature, so storage will now be a factor on how to maintain the solidity sa kagahi sa dosage form nga suppository. So in other words, ang gamiton nga suppository base para mo melt is one suppository base. If the suppository base gamiton nga gusto nato nga ipa-dissolve siya at body fluids, lahi na sad siya nga suppository base. So in other words, there are different kinds of suppository base depending on how it is administered. How the drug is released from the body, the chemical and physico-chemical properties of the drug. Those are the considerations that are factors that are to be considered in the formulation of dosage form. So, ang importante jud kaayo is the physico-chemical properties of each ingredient, which I mentioned that before, and how the drug is released from the dosage form. Yes, very interesting, di ba? So, kinsa may nakasuway og Dulcolax suppository? Anyone? Wa jud nakasuway og suppository ninyo? And then in the counseling also ani, naana po i-counsel ang pharmacist ani. Diba? Na there is a way of administering this suppository so that effect would be obtained. Kay ma-imagine ba ni Ray nga gahi ang suppository ipasok sa lubot, di ka na mga samad ang inyuhang lubot. Diba, Mark? Justin? Diba? So, unsaon man na sa pharmacist pag counsel? Basin baya og ipasok diretso niya. Lain na po'y mahita, mga samad hinuunang lubot ninyo. So the pharmacist now will counsel. So unsay buhaton tangtangon ang panit. Kay basi ipasok diretso na ay panit. No? And then before tangtangon ang panit, i-roll usa or ipa-warm usa siya sa palad. Palad nato is kuan man kanang warm. So i-warm dito kadjud kay imagine nagikan na siya sa ref. Because suppositories which are solid at room temperature, mo-melt na siya kung taas, kung init. So it is stored sa lower temperature. Okay. Kung aircon siya, no need to place in the ref. Kung aircon ang kuan. No? So dapat dili siya. That is why ang mga mga pharmacy karon do na joy kanang control sa temperature sa butika. Okay. So you can just imagine how solid it is. So how hard it is. So warm na siya before ipasok sa lubot. Yes, Ray, you raised your hand earlier.
Yes, Doc. So, kanang mas soft ang kanigong suppository, Doc, kaysa katong sa tablet, no?
Naay tablet pod nga suppository. And actually, the tablet form nga suppository, these are the ones that melts, that dissolves in the body fluids. So you have this vaginal suppository. They come in tablet form, but they are administered vaginally. So, how does the active ingredient released? By dissolving the body fluids. Importante kayo ang counseling ani. Why? Because if the patient buys vaginal suppository na pasig imnon, will it matters? Yes. Mo matter siya kalahi man ang environment where the drug melts or the pharmaceutic ingredients melts. It's not the kind of environment nga maka-release sa active ingredient. Ana ba? So, the active constituents from this suppository can be released by one, melting, another is by dissolving. Yes, shall we go on? Another questions? So, timan imin you ha, ma-pharmacist na gani mo or bisan dili mo ma-pharmacist, and then makabalo mo nga na ay mag-administer og vaginal rectal suppository, for instance, kay gahi man siya, i-remind nga i-warm sa kadyot between the palm or between your fingers before siya ipasok. And then remind them also nga tangtangon ang panit before ipasok. Okay? Pero before that, kahugas yung kamot. Any more questions before we go on to the next topic, which is the definition of drug categories. So there are different categories, there are different forms now of dosage forms, different states rather. You have liquid, solid, semi-solid dosage forms. Okay. Shall we proceed?
Yes, Doc. Thank you.
Yes. Now we move on. This is our last topic for this semester. Definition of selected drug categories. Categories, they are categorized based on the use of the drug. So let us understand this one by one. Analgesic. This is a drug that suppress pain disperception without inducing unconsciousness, or in a simple way of defining, it relieves pain. You are familiar with this. Sa example ani, kung masakit mo, if you feel pain, what do you take? Masakit ang ulo sa inyong imnon.
Paracetamol, Doc.
Paracetamol, yes. Meaning the paracetamol is categorized as analgesic. Correct? Okay. So this is a drug that suppresses pain perception without inducing unconsciousness, or it relieves pain. Example, paracetamol. Somebody nag-raise of hand? Nag-raise of hand? Any question? Wala. Naman ko initingog. Sa man to?
Sa comment to, Doc.
Nag-comment. Let me see yung say comment. Sorry ha. Dili ko kabasta dayon. Yes, paracetamol. So when you take paracetamol, you are taking analgesic. So unsa pa may lain use sa paracetamol? Yes, you have this antipyretic. This is a drug that restores normal body temperature in the presence of fever. Meaning to say it reduces high fever or fever. In other words, dili ka ng, kung mo take ka og antipyretic, it doesn't mean nga mo lower ang imuhang body temperature. It restores normal body temperature. Kay kung mo lower ang body temperature, then it's not antipyretic. It's hypothermic na siya. In other words, mulog yun siya ang temperature niya. But the antipyretic, mo restore, mo balik na siya dito sa normal body temperature in the presence of fever. So, when you have nabad ang ulo, headache, dapat yung fever, then what do you take? Mahilantan, labad ulo. What do you take? Normally, usually.
Flu.
Ha?
Biogesic.
Biogesic, paracetamol. So in other words, biogesic is analgesic and antipyretic at the same time. So the therapeutic term of those drugs that restores normal body temperature in the presence of fever, they are categorized as antipyretic. Kato pain reliever or relieves pain, analgesic. Okay, so yun rin, no? These are very common. The third one, antacid. Drugs that neutralizes excess gastric. This is gastric acid. This is common to you. What antacid do you know?
Kremel S.
Yes.
S.
Yes, Kremel S. And how do you take Kremel S? Is it
Ichu, una daw.
naay Kremel S nga chewable. Naay Kremel S na taken orally with water. Naasay Kremel S in suspension. So different dosage forms with the same use. Mo depende na siya sa unsay choice sa pasyente. Kay if there are the latest I think is Kremel S chewable na siya, naman yun na siya sa pack, no? Sa iyahang foil nga chewable. Now, you understand nga ayaw na siya imna kung naay label nga chewable. Why? Because these chewable tablets do not contain disintegrant. And the disintegration starts diri sa mouth pa lang. Kaya mo hamang i-chew. So disintegration starts sa mouth pa lang. And atong oral tablet, meaning Kremel S tablet that are taken orally with water, nato siya disintegrant. Okay? So, you read the label whether it is chewable or not chewable or to be taken orally, haron maximize ang effect nga ma-obtain if you take the drug in a proper way. So kung imnon, imna. Kung paras lubot, ayaw imna. Ala ba? Kay haron, active ingredients could be released in a proper environment. Okay. Another. So, anti-diarrheal. Drug that inhibits intestinal peristalsis. It is used to treat diarrhea. Peristalsis means paspas ang mobility sa intestine. So kung paspas ka siya, so mo paspas po ang gawa sa poops. And so if you have that kanang situation, then nag-diarrhea na ka. And the drug that inhibits this paspas ka poop is categorized as anti-diarrheal drug. Okay. Then we have anesthetic general at duha man gud nakaklase. Unconsciousness. Naunsa man akong spelling? Never mind. Anesthetic general, a drug that relieves pain perception by inducing unconsciousness. Meaning to say, general anesthesia kung the whole body mawala jud ka sa kalibutan. No? Local anesthetic drugs that eliminates pain perception in a limited body area by local action of sensory nerves. Meaning, asa nga area gi-administer, dito ra ang walay perception of pain. Sample, ibtan kag ngipon. So dito ra sa baba nimo or lagos nimo ang walay pain. So, general anesthesia, general the whole body, ma-unconscious jud ka. I mean, mawagtang nyo kas kalibutan, you don't feel pain. Local anesthesia or anesthetic dito ra sa site where it is administered. I think you understand that. Antilmentic, drug that eradicates intestinal worm infestation. Mo na ni siya si mebendazole para deworming, no? Okay. Para pawa sa bitok, that is termed as antilmentic. Antibacterial, a drug that kills or inhibits pathogenic bacteria, the bad bacteria, the disease-producing bacteria. These are the antibacterial. Natay antimicrobial, the microbes, and the antibiotics. So these are the categories nga mo specify good kung unsay iyang i-inhibit, no? So those that kanang disease-causing bacteria, these are treated by drugs that are antibacterial. Then you have, So when we say antibacterial, when you read a literature or a label sa drug na inyong gipalit, kung antibacterial na siya, dili na siya makapatay or maka-inhibit sa fungus or sa virus. Tay specific siya sa bacteria. Okay. Now in your micro subjects, you will know unsa ring mga pathogenic bacteria, unsa ning mga fungi, mga virus. So if it is antibacterial, ang bacteria ra iyahang patyon or i-inhibit a growth. So antifungal, fungus ra pod iyahang i-inhibit, dili bacteria. Okay? So when a patient comes to the pharmacy then asking for an antibiotic, it could be antibiotic, it could be na may uban nga antifungal siya or antibacterial siya. Pero kung antibacterial ra gyud siya, this you must know what causes the disease. Kung bacteria gani, then antibacterial lang ihang datat. Antifungal kung fungus ang ni-cause. Now, we have this antifungal systemic, the drug that kills and inhibits pathogenic fungi, and this systemic meaning in the body na siya. Kay naamampoy antifungal nga topical that is applied externally to kill or inhibit pathogenic fungi. So, kung systemic into the body, into the system, that goes into the system, because there are fungus, diseases caused by fungus nga naa sa system, and naapoy fungus nga naa ra sa skin, and that's what we call antifungal. So specific yun siya nga causative agent for a drug. Kung fungus, antifungal. Kung bacteria, antibacterial. Kung antibiotic, both specific food supposed to be ang causative agent that cause the disease. Okay. So let's move on to anti-hyperlipidemic. Those drug that lowers the plasma, cholesterol, and lipid level. And this can be determined kung taas ba ang cholesterol or lipid level by laboratory test. No? You have your lipid panel. Kung taas na gani, 150 above ang cholesterol, na you need to exercise or isa pa, adjust, modify your lifestyle, or kung di pa yun ba na, og nainom na ka og anti-hyperlipidemic drug. Example ani kani mga statins, no? Simvastatin, ana. Okay. Now, antihypertensive agents, drug that lowers arterial blood pressure, especially the elevated diastolic pressure of hypertension, mga high blood, antihypertensive agents. Antispasmodic, a drug that inhibits the motility of visceral smooth muscle sa tiyan ni siya, no? Kung paspas ang motility sa tiyan, ang movement sa tiyan, then mosakit ang imuhang tiyan, then the term for the drug falls under this category, antispasmodic. Example, sakit ang tiyan, tagaan ka og Buscopan. Okay, the Buscopan has an antispasmodic activity. So the therapeutic term that inhibits the motility, kay paspas ang movement, no, sa visceral smooth muscle, sakit sa tiyan, they are categorized as antispasmodic or antispasmodic. Okay. So, kung moingon to og antispasmodic, ayaw po na siya ihatag, don't give terms to the patients nga kanilang imuha kay antispasmodic man eh. Ha? Usa na antispasmodic? So, masayon siya ingon nga para man sa sakit sa tiyan. Okay? So, but you already know that antispasmodic meaning para sa pawala sa sakit sa tiyan. Okay. Another term is antitussive, a drug that suppresses coughing. I-suppress niya ang coughing. Now, please aware that there are different terms that relates to coughing. One is antitussive and the rest will be discussed later. So, antitussive drugs that suppress coughing. Then you have antiviral drug that kills or inhibits viral infection. Then you have astringent. Kuning usa isahon be aron dili mo ma-distract. Okay. This astringent drug that used topically to toughen or shrink tissues. Now, in other words, for example, you apply a drug on a wound, no? Unya, ang imuhang purpose ana kay haron siya mo ay capsules. Ang tissues ana niya is the integrations haron siya maayo. Okay? That drug, example, the very common sa mga probinsya is the ininit pinabukalan nga dahon sa bayabas. Have you heard of that? Ilahang ang dahon sa bayabas, and then ilang ihunad, ilimpyo sa wound. Then the bayabas contain a drug that causes the shrinkage or mo-shrink sa tissues. That active ingredient nga na sa bayabas is categorized as astringent. So, ang iyahang action is iyahang shrink ang tissues, promoting the healing of the open wound. So these are topically, meaning on the skin, topically administered to shrink the tissues, causing the healing of the wound. Okay, that is astringent. Now, this is always thought of astringent nga sa cosmetics. Astringent, ang ilahan nilang huna-huna sa astringent is kanang palimpyo sa nawong. But medicinally, it is a drug that causes the shrinkage or must shrink the tissues. Sa wound, makahil siya. Okay? Let us continue. Bronchodilator. A drug that expands bronchial airways. It is useful in treating asthma. So kasagaran, bronchodilator ang naa sa leaflet or naa sa label for those who are asthmatic. No? Then you have cathartic, promotes defecation, makapoops. Usually considered stronger in action than laxative. In other words, laxative, makapoops pag ni siya, but lighter compared to cathartic. So cathartic, they are usually given for specifically for patients who are going to be, let's say, i-x-ray sila. No, nga, let's say, na sila x-ray sa tiyan dapit, no? Or sa tiyan or let's say mag-CS nga kinahanglan matangtang gyud ang mga whatever na hibilin diha nga ipoops gyud nila. So a stronger action should be given. So cathartic na siya. Pero kung pa-mild lang na constipate siya and then ipapoops lang siya, have a milder action. That's what we call laxative. Okay, so promotes defecation, usually considered stronger in action than laxative. Promotes defecation, meaning makapoops. Caustic, a topical drug that destroys tissue on contact. It is useful in removing skin lesions. Okay, I think you have heard this in a negative way nga sodium hydroxide, these are caustic, meaning when this sodium hydroxide solution come in contact with your skin, makadaot yun sa skin. But as a drug, it is useful in removing skin lesions. That's what we call caustic drugs. Then you have demulcent, a bland, viscous, liquid, usually water-based, used to coat and soothe damaged or inflamed skin or mucous membrane. So, makapasuten siya sa mucous membrane. This is normally termed for drugs that are taken internally. And it is also used for inflamed skin. But more often, demulcent more often is termed for in drugs that are taken, administered internally. That's demulcent. Unsay gamit niya, unsay mechanism niya, iyahang i-coat and soothe damaged or inflamed skin or mucous membrane. That's demulcent. Another is disinfectant. Agent that destroys microorganisms on contact and is suitable for sterilizing inanimate objects. Now, emphasis on the inanimate objects because this will differentiate on the use of antiseptic. These are chemical agents that slows or stops growth of microorganism that is applied on living tissue. So what's the difference? Ang difference niya kani para sa inanimate objects, meaning sa lamisa, so anything na walay life. The term used, the proper suitable term used there is disinfectant. Now, antiseptic, those that are applied sa living tissue. No? So, kung ang alcohol gigamit para makastop sa growth applied on the skin, it is termed as antiseptic. Kung ang Lysol is applied to sterilize mga scissors gagamiton sa OR, these are termed as disinfectant. So they have the same use but different way of application. I-apply sa inanimate, termed as disinfectant. I-apply sa living tissue or skin, they are termed as antiseptic. Do not forget, so ang Lysol, dili siya antiseptic but disinfectant. Diuretic, a drug that promotes renal, makapaihi of electrolytes and water. It is useful in treating generalized edema. Kanang nang hupong, to paimnon siya og diuretic, karon mapagawas ang water in the body. That's diuretic. Those are the drugs under this category. Drugs that promotes renal excretion of electrolytes and water. Then you have emollient, topical drug, especially on oil or fat, used to soften the skin and make it more pliable. Parehara siya sa demulcent. No? They have the same use. Musuten siya, musoften siya. But this is used sa skin. And they usually contain oils or fats, ang emollient. Okay? So you have to know the difference between demulcent, the similarities and difference between emollient and demulcent, disinfectant and antiseptic. Then you have expectorant, another term that relates to coughing, no? A drug that increases respiratory tract secretions, lowers their viscosity, and promotes removal. Expectorate manang ipagawas. So iyahang ilasaw ang secretion. So kay niglasaw, ma-increase ang secretions pero ma-lower iyang viscosity and then ipagawas niya. So ang antitussive earlier is-suppress ang coughing. Kanis siya karon ang expectorant, it will increase the respiratory tract secretions, lowers their viscosity, and promotes removal. That's expectorant. So, you have antitussive, you have expectorant. And myotic, drugs that used in the eye to induce constriction of the pupil. Then you have mydriatic, drug used in the eye to induce dilation of the pupil. So you have to know also the difference between these two. Myotic, constriction of the pupil. Mydriatic, dilation of the pupil. Now, I think this would help you in remembering the difference between the two based on the movement of your mouth. When you say the word myotic, unsay movement sa inyong lips? Iba gamay, myotic or mouth, lips. Myotic, mo gamay. Pero when you pronounce mydriatic, iba bunga nga. Mydriatic, so that induce dilation of the pupil mo dilate mo dako. Myotic, mo gamay mong mo induce pud siya og constriction mo gamay ang pupil. Gets ninyo? Are you still there?
Yes, Doc.
Okay.
Yes, Doc.
So the mouth also helps in in associating, no? I-associate ninyo sa movement sa mouth, myotic, constriction of the pupil, mydriatic, dilation of the pupil. Okay. Nakatawa mo diha. Okay. Mucolytic, another drug that relates to padag-ubo, coughing gihapon ni. A drug that hydrolyzes mucoproteins. It is useful in reducing viscosity of pulmonary mucus. Okay. So, I think you are familiar katong mga sigig giubo, mga hubakon na ay mucolytic nga label. So with mucolytic, kabaw na mo unsay action. It hydrolyzes the mucoproteins. It also used in reducing viscosity of pulmonary mucus. So, iyahang lasaw na sad, no? Ang viscosity. Viscous meaning lapot. Okay. Of pulmonary mucus. That's mucolytic. So, how many terms na in relation to ubo? You have antitussive. You have, what's the other term?
Expectorant.
Expectorant. Then you have the mucolytic.
Mucolytic.
Very good. Sedative, a central nervous system depressant used to induce mild relaxation. A stimulant, drug that increases the functional state of the central nervous system. Ang uban mo claim sila nga ang coffee kuno is a stimulant. Ang uban, ang kape para nila makapakatog. So depende ra gyud na sa tao, no? But basically, those stimulants are drugs that increases the functional state of the central nervous system. Ang uban mga estudyante, mag-study sila, daghanon nilang inom og kape, haron ma-alert sila because for them it stimulates their brain. Nagyan daghang dugay makatulog. Okay? Tranquilizer, the last term, a drug used to suppress an accurately disturbed emotional state. Ay, nabuwagan sa uyab or whatever, chuchu, nga nakadisturb sa emotional state, then you gave a person a tranquilizer. Karon siya makalma. Okay, so this is, I think, the end of the complete terms is that. Anyway, I will give you a copy on this. Kay maluoy sad ko ninyo, no? Copy on this so that it would be easier for you to study, but hoping that during the examination dili mo mo cheat kay cheaters suon ra na sa liars and then they all go to hell. Char.
Yes, Doc. Thank you, Doc.
Okay. So, I hope that you enjoyed another information that are given to you this morning, and so you will be more conscious when you buy a drug or medication. Basahon dayon ninyo ang label, and then mo ni ang gi-discuss na mo sa receptives in pharmacy, mucolytic, expectorant, antitussive. Then you know on your mind what unsay difference ani. So you would also know how this drug works in your body when you take or administer. So suppository, para unsa gani ni analgesic, disya pain reliever. So kung analgesic, suppository, analgesic, para unsa gani ng analgesic?
Pang pain reliever, Doc.
Pain reliever. Unya, asa gani siya isulod? Kung rectal, sa lubot.
Yes, Doc. Depende
Okay.
sa yung route of administration.
Yes, that's correct. Pero kung analgesic siya, local or systemic effect?
Systemic, Doc.
Systemic effect kung analgesic siya para sa hilanat, because I don't know if it is still available karon na ay sopirin suppository, no, opigesic suppository. I don't know if it is still available na suppository na siya. This is administered to the mga bata kay dili ka inom labi na kung mag-vomit ang bata. Hilantan, nga nag-vomit, so inipainom nimo o tambal isuka. So, gamitan og suppository. And that is systemic. Hemorrhoids, suppository. Local, systemic.
Local?
Local, kung iyahang itangtang ang iyahang inflammation, no? Okay. So, ibutang lang yun sa huna-huna ninyo na kung on-site, gani, local. Kung layo from the site of administration, it goes to the system, then it is systemic. And that is true also to ointments. Okay. Any questions? Okay. So, yes.
Ang sa isa ka tambal, do, sa isa ka drug, isa ra gid iyang category ano, or it could be more na isa ka drug na more than one iyang category?
Kung ang iyahang ang iyahang active constituent is paracetamol, analgesic ra gyud na siya ang use. But they may come in different dosage forms.
Okay, Doc. Okay, Doc. Thank you.
Okay. Okay. So that's why the doctors are not so familiar with kanang brand names, pananglitan. Biogesic. The brand name is paracetamol or acetaminophen. Nay ubang mga brand names nga ni contain og paracetamol or acetaminophen. So the doctors would prefer the generic. So when the doctor prescribes acetaminophen, para gyud na siya sa sakit or sa pain reliever gyud na siya, or antipyretic also. Okay? So the category of the drug would sa kuan na siya, mo depende na siya sa constituent. Okay, so if there are no more questions, let me proceed now to the next discussion on our next activities for December 7. Diba? 2 meetings na lang ta? December 7,
Yes, Doc.
Tuesday,
7 and
and then December
10.
10. And then next week, next week, finals na. Okay.
yes, Doc.
Now, this would be the schedule. Now, paminaw mo, ako lang po hinuon yung i-post, pero paminaw, basta nakalimot ko i-post. On December 7, is everybody in? 59 ratakaron, including myself. Now, December 7, we'll have a quiz on dosage form and selected drug categories. This will only be 30 minutes. And you have to stay because I am going to discuss the project that is going to be part of your finals. Simple rin ka project, inyuha lang tong i-collate what were submitted or submitted sa inyuhang activities. Inyuha lang i-collate into one, then mo na ang project. So I will discuss that after the quiz next meeting. So I hope that you will you will join the class or mo in na mo before inyong time 9 o'clock, before 9 o'clock, so that we can start immediately with the quiz and stay online for the discussion. The discussion will, I think, takes 15 to 20 minutes. Is that clear?
Noted on
Yes,
that.
Doc. Yes, Doc.
Okay. Now, I am still waiting for halos everyday ko ga-check whether maka-encode na ba ko sa inyong grade. Because until now, at last night or yesterday, dili pa ma-encode ang grado ninyo. And daghan kaayo kung usa-usahon ako og email sa inyo ha. But for me, kung naka-encode man good sa automate, pas kaayo ang pag-encode, ang pag-send. I hope that it will be available na this week for the semifinal grades, para encoding na sa semifinal grades. So, ma-aware na mo sa inyong grades before the finals. Now, very important, I will not call your attention for those who have not submitted their activities from activity 1. What is the disadvantage? And what is the advantage? Kung inyo lang tong i-deadma, nakabuhat na og grade si ma'am. Kung inyo harang tong i-deadma, i-ignore lang to ninyo ang activities that you have not submitted, that will greatly affect your grade, specifically in the midterm. Because I changed my mind. Actually, I'm done with the midterm grade. It changed my mind. Remember, sa inyong midterm, I told you that whatever your score sa major exam, midterm exam, will be the same sa inyong quizzes. Remember that? Did I tell you that?
Wala, Doc.
Wala. Ako rin nakahinumdum. Basin dili sa inyo ha. Kasi wala man tay quiz sa midterm, di ba? Natay
Yes,
quiz.
Doc.
Wala tay.
Yes, Doc. Wala, Doc.
Yes. So, I thought I told you na whatever grade sa inyong midterm, whatever score sa inyong midterm will be the same sa quizzes. Pero I changed my mind. Ang akong I base the scores ninyo sa midterm sa quizzes on your activity to give more credit sa inyong activities. So in other words, the activities ninyo would carry sa class standing and your quizzes. So that would be attendance 10%, class standing 10%. So the class standing is your activities. And then quizzes, activities, and then the periodical test, which is 40% ang inyong periodical exam. And that makes your grades better. Kay lavish kay kung naghatag og score sa activities, especially if you really have made it complete ang contents and presentable and organized, complete. The content is complete. Organized, presentation, complete. The content and complete. Okay, those are the criteria that I based in grading your activities: presentation, organization, content, and completeness. So katong mga char-char lang haron makasubmit lang, okay, char-char lang po akong score. No? Okay, so in everything you do, give your best, specifically sa activities, because this is the only way, or this is one way of having good score in giving your activities. Do not make it as do not take this for granted, but give your best. Okay? So, overtime na ta. Are you still okay na may classes sa next? You have a class at 10 o'clock?
Sa 1C, Doc, wala, Doc.
Okay. So, stop presenting na ko. So, any more queries? So, I will repeat, examination December 7, then that would only be 30 to 35-minute quiz, and then discussion of the project for the finals. That would be given on December 7. Napa di ay? Pag-unsa data sa December 10. December 10 is a big day for you. Do not be absent because we are going to review all the topics discussed from prelim to the final term. Meaning, na ako ihatag pag yun ani kata atong form nga I am a pharmacist. I will give it to you next sa December 10. So mag-review ta sa topics, and this would be in preparation for the final examination, which the coverage would be from the beginning. So do not be absent. Pauli yun mo, asa mo dapita, pauli yun mo. You must be present on December 10. This is a big day for you. Okay? Isa tong nag-raise of hand. Go ahead, kasi itong nag-raise of hand. I can see you here. Any questions?
Doc, anang sa tanan na siya nga subjects, Doc, ang coverage yun sa finals is from prelims until finals?
Depende sa teacher, oy.
Okay.
Ako,
Okay, Doc.
sa ako, gikat kita sa sinugdan. And then, haron ma-pick out nato which are essentials, which are important, that you should carry with you throughout your life. This is not only for perspectives in pharmacy, but you have to carry this to the grave. Hantod kamatayon na ni atong banding ani sa perspective. As you will become one of us someday. 4 years from now, pharmacist na mo, mga future pharmacist, daya mo. So whatever you have learned in this subject, dadalaon na ninyo. Okay? Yes? Any more queries before we leave or before you leave? Any questions?
None from me, Doc.
Okay. What about the others?
None, Doc.
Wala na.
None po.
And Doc.
Okay, so if there are no more questions, please take note of the schedule. December 7, quiz and discussion. December 10, review in preparation for the examination on December 14. Oh, second day man tano? 14. Hopefully, our last and reminder for those who have not submitted their kanang kinsa to'y kulang sa activities, please, ako pa nang dawaton, maay na lang, doon na mo'y 50 points kaysa 0 gyud. It really affects. Tagaan na tang nako og 50 points, bahala na siya og failure na siya nga grado kaysa 0 because let's say you have 2 activities for that term. Yeah, kada activity is 100 points, di ba?
Yes, Doc.
Kada activity 100 points. Now, if the 2 activities 200, usara imuhang na-submit, si tinta pag yun. So 0 na ka. So pilay total nimo instead of 200, 70. So kung muhatag ka, at least kanang 70 is na ay equivalent grade. Kung if you are going to submit, let's say mga 100, let's say 50 ang points may hatag na ako bisan late. Because requirement man ko na siya. Doesn't mean nga i-ignore lang na siya. Atong wala ka ka-submit. Tagdi na lang og pila ka points basta naa kay sa 0. And then it would give me a bad impression on you if you do not submit your activities complete. Okay? Okay. You may now leave, and then if you have some queries nga you want to talk it over with me, you may stay. Then usap tayo. Okay? As adjourned.
Okay, Doc.
Thank you,
Okay,
Doc.
Thank you, Doc.
Thank you, Doc.
Welcome.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Love you, Ignacio.
Bye, Doc. God bless.
Bye-bye. God bless, Ray. Silent lagi karon Mr. Pastorisa. Oh. Yes. Ayoko i-review, i-check ang imuhang mga activities. I-check. Oo. Hulata lang. Hulata lang. Actually, nagpaabot ko kano sa makain ko. Ako'y record kay every after class, yes, naamay isa tawag ani, na ay Chrome extension nga gi-attach so that after class will appear dayon ang attendance. And it will also appear whether or not ni come in mo on time or na late. Oo, kay kung ni come in mo og 16 minutes or let's say 9 o'clock inyong klase and you you joined 9:16 or 9:20. That's late already. Welcome. Yes, Malik.
Thank you, Doc. Bye, Doc. God
Bye-bye.
bless.
Thank you, guys.
Yes.
Lingaw kayo. Thank you, guys.
Yeah.